Khapzory Vial is a medication that is used to treat or prevent serious blood cell disorders caused by certain drugs, such as folic acid antagonists like methotrexate, trimethoprim, and pyrimethamine. It may also be used with a certain cancer drug, 5-fluorouracil, to treat patients with colon cancer. Talk to your doctor about the benefits of this medication for your specific condition and the best time to take it. Follow your doctor's instructions carefully for the correct daily dosage and timing. When using Khapzory Vial, it will be given to you through an injection into a vein as prescribed by your doctor. The frequency of the injection can vary, typically every 3 or 6 hours, but for colon cancer treatment, it is usually given once daily. It is important not to inject this medication into the spine. Your doctor will determine the dosage based on your medical condition, body size, and how you respond to the treatment. If you are administering this medication at home, it's important to learn the preparation and usage instructions from your healthcare professional and the product package. Before using the medication, make sure to visually inspect it for any particles or discoloration. If you see either of these, do not use the liquid. Also, be sure to learn how to safely store and discard the medical supplies. In order to get the most benefit from Khapzory Vial, it should be used regularly. To help you remember, try to use it at the same time each day. Some common side effects of Khapzory Vial include nausea, vomiting, diarrhea, or mouth sores. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the potential side effects. Many people who use this medication do not experience serious side effects. While it is rare, a severe allergic reaction to this drug may occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not mentioned, be sure to contact your doctor or pharmacist. It's important to discuss any concerns you may have with your healthcare provider. Before using Khapzory Vial, it's important to tell your doctor or pharmacist if you have any allergies to levoleucovorin, leucovorin, folic acid, or folinic acid, as this product may contain inactive ingredients that could cause allergic reactions. Additionally, make sure to inform your doctor or pharmacist about your medical history, especially if you have certain anemias due to vitamin B12 deficiency. If you are planning to have surgery, it's crucial to let your doctor or dentist know about all the medications and herbal products you are using. If you are pregnant, Khapzory Vial should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown whether Khapzory Vial passes into breast milk. When taking Khapzory Vial, it's important to be aware of potential interactions with other medications. This can affect how well your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and over-the-counter drugs, as well as herbal products. Be sure to get your doctor's approval before starting, stopping, or changing the dosage of any medicines. Additionally, it's important to note that Khapzory Vial should not be used with medications containing leucovorin. Always follow your doctor's instructions and guidelines for the best results. If someone has taken too much Khapzory and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share Khapzory Vial with others. While using this medication, it's important to have lab and/or medical tests, such as kidney function, complete blood count, and folic acid antagonist blood levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. Make sure you take each dose of Khapzory Vial as directed by your doctor. If you happen to miss a dose, speak to your doctor or pharmacist immediately to determine the best course of action. Do not take a double dose to make up for the missed one. When it comes to storing Khapzory Vial, it's important to follow the specific instructions for the brand you have. Make sure to keep it out of reach of children and pets. And when it comes to disposing of the medication, be sure to do so properly by consulting with your pharmacist or local waste disposal company. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. And always discard the product and it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.